Today I'm going to talk about different approaches to improve efficiency in healthcare. The primary purpose of this presentation is first to examine the sources of inefficiency in pharmacy practice in general, especially considering whether the system is utilizing the resources in the best possible way, and whether and where there are opportunities to create savings or efficiencies by reallocating resources. Global pharma expenditure, as you all know, is increasing at an unsustainable rate, including the expenditure of pharmaceuticals and the money spent on medication-related problems resulting from medication errors and inappropriate prescribing, which represent a major public health issue. So pharmacists, with their unique position in the healthcare system between the multidisciplinary teams and the knowledge of medications, are considered an important figures in reducing healthcare spending through cost saving and cost avoidance. Cost saving refer to reduction in current spending of medications due to changes in the expense on current treatment, patient treatment, for example, switching from an IV drug to oral therapy where appropriate. Cost avoidance refers to an intervention that reduces the potential future expenses that may have occurred if we don't adapt the intervention. As you all know, the past few decades have seen considerable advances in the way different diseases are diagnosed and treated. However, with the ongoing pressure on limited healthcare budgets, equal access to the latest innovations and their affordability have been a challenge to healthcare systems. So we have seen significant delays between the time of regulatory approval by regulatory bodies and the real access for patients to those medications. I'm sorry. Okay, so one of the most important sources of inefficiencies in healthcare system is the delay in diagnosis and treatment access. And in the second section of this presentation, I will try to propose solutions that can be provided by pharmacists to address those challenges. Another important source of inefficiency in pharmacy practice is the use of medications or interventions that have marginal benefit, either ineffective treatment, inappropriate, or not cost effective. So low value care means that we are using interventions that offer marginal benefit while we are not with the cost that can be used with something that provide better value to our patients. Another source of inefficiency is the poor adherence to treatment. For example, in Europe, non-adherence to prescription medicines cost around 125 billion per year, and also cause nearly 200,000 premature deaths. Also, medication error can be a major source of inefficiency, and we will talk about the pharmacist's role in reducing these inefficiencies. Other source of inefficiency is the lack of value assessment of newly introduced technologies. And the only way to address this is by the use of health economics. And Dr. Zaid will talk in details about the pharmacoeconomics and their use in showing the value of medications. Lack of real-world data also can be a source of inefficiency, as you know, real-world evidence can capture the variations in providing care can help in finding or identifying patient-relevant outcomes, guiding the improvement in care, and also to target care more effectively and support the use of the innovation in the hospital. So to sum up the first section of this presentation, the most commonly known sources of inefficiency are lack of value measurement, the use of marginal benefit interventions, medication errors, poor adherence, lack of real-world evidence, and delay in diagnosis and access to medications. So now let's look at different approaches that can improve efficiency in pharmacy practice. The first one is, well, as I said, we have issue with the assessment and uptake of new drugs. There is delay in access and the medications after they get approved by authorities. So these are some of the solutions that can help in improving efficiency. Well, early access schemes and managed entry agreements are now increasingly used as a way to provide early access to patients to promising new approved medications, whilst also provide opportunity to collect real-world evidence on the impact of these drugs on the in the real world. Also, it is important to consider a full societal value of the new medications, not only the clinical outcomes, but also the impact of different dimensions of quality of life, if there is loss to productivity, and that includes also the impact on caregiver as well. Also, it is important to have a tool to help you in prioritizing your needs. And health economics or economic analysis in general can inform resource allocation decisions, including any program, including early detection program, treatments, and detecting which treatment you would prioritize for your patients. Another approach to improve efficiency is to empower the role of pharmacists to expand the services that pharmacists can provide to patients, including eliminating ADRs, inpatient medication reviews, drug use policy that can promote the most cost-effective use of medications, providing counseling, participation in ward rounds, and most importantly, formulary management. So starting with ADRs, a chronic challenge to pharmacy practice. As you know, inappropriate prescribing is recognized as a major problem, both clinically and economically, to any healthcare system. And these medication error can lead to or have a major impact on patient morbidity, mortality. They can result in increased healthcare utilization by extending hospital admission, increasing ER visits, increasing the use of all the services in a healthcare system, which lead to expanded expenditure, of course. As you can see, pharmacists can have impact in preventing all these costs and reducing medical costs by reducing ADR, reducing mortality and morbidity, limiting the length of a stay, which lead to reduced utilization to the healthcare system in general. It is also important to highlight that patient use of medications should be reviewed for appropriateness before giving the patient dose medications. And medication use review, which involves one-to-one discussion between the pharmacist and patient, can improve the patient knowledge, adherence, and use of medication, can also identify if the patient is really taking their medication at all, or if they're taking them appropriately. So it can provide an opportunity for the pharmacist to review the pharmacotherapy, including the prescribed drug over-the-counter medicines, which help in reducing wastage and optimizing care. This is an example to illustrate the extent to which medication review can help in reducing wastage. In 2009, it was estimated that medication wastage in national health services in England can reach 300 million per year, including 90 million that is represent the unused prescription medicines that the patient is keeping at home, and 110 that is returned to community pharmacies. However, the pharmacist cannot dispense them to other medications. This led to a huge campaign by NHS to make sure that the medications are reviewed before dispensing, and the patients are aware of the pharmacy policy. The participation of pharmacists in ward round has been shown that more cost effective than the consultant-led ward rounds in terms of improving the allocation of resources in terms of medication in particular. And it has been, there are several studies that shows that pharmacist participation in ward round is directly proportional to reduction in healthcare costs. Formulary management can be an area where pharmacists can have a huge impact on reducing the expenditure by providing comprehensive evaluation both clinically and pharmacoeconomically, and also by applying restrictions of medications to specific specialties, to specific indications, or even sometimes dosing limitation or duration limitation. Also, pharmacists can develop drug use policies that guide or promote the most cost-effective use of medications. Also in conducting pharmacoeconomic studies to inform decisions, and in conducting annual reviews to make sure that the drugs or the medications are used in compliance with the drug use policies. Also, pharmacists led outpatient clinic, including diabetes mellitus community clinics, hypertension clinics, have been also shown to have a good impact in the overall control of chronic diseases, and improving patient outcomes and reducing complications, hence reducing the overall costs on the system. In the retail pharmacists can also have an impact in improving patient outcomes and reducing cost as well, by recommending the non-pharmacological approaches such as first-line solutions, providing the most appropriate OTC drugs if appropriate, which limit the use of more expensive specialties such as GB or ER. Also, it is sometimes they have rule in recommending generic medicines rather than brand. This is also an example of the role of pharmacists in another area, in the ICU. This is a study that was conducted 2 years ago in one of the tertiary hospitals in Riyadh, where pharmacists worked on antimicrobial stewardship program. The study showed that the program was responsible in improving patient outcomes, including reduction in mortality, reduction in drug resistance, and of course, reduction in costs. This graph, these two graphs shows the impact of the antimicrobial stewardship program on cost. As you can see, the graph on the left shows the impact on consumption of the most commonly used antimicrobials in ICU, including caspofungin, one of the most expensive drugs in any hospital. The second graph, the one on the right, shows that the total cost of medications only is reduced from 1.8 million to below 1 million rial in that year. And I would like to mention here that this study did not include the cost of other things, such as, for example, the reduction in complications, reduction in adverse events due to the better control of the use of antimicrobials. Also, pharmacists can have impact in high-risk areas such as the chemotherapy areas, the ICU, the AR, as these areas involve sometimes difficult decisions when it comes to medications, and pharmacists can have here positive impact by preventing adverse drug events, morbidity, mortality, and of course, healthcare costs. One of the good practices or the good approaches in providing a long-term and very significant saving that can be initiated by pharmacists is the use of generics and biosimilars. As you can see here in this graph shows the cumulative saving in several European countries between 2015 and 2020 due to the use of generics and biosimilars. The blue bars represent the use of biosimilars, while the orange ones represent the use of generic versions of small molecule drugs. So to sum up, different approaches that can help in improving efficiency in pharmacy practice, including the assessment of the value of new items, empowerment of pharmacists in general and clinical pharmacists in particular, appropriate follow-up through ward rounds, medication review sessions, and outpatient clinics, and investment on data. Other strategies that can also have an impact on reducing the overall spending through the pharmacist is to optimize the use of workforce. For example, hiring full-time clinical pharmacists in high-cost services such as ICU or ER, the use of evidence-based driven management protocols, especially when it comes to medications, better control of procedural supplies, the operational supplies in the pharmacy, strict administration policies to minimize the overheads, and any procedure to help reducing unnecessary hospitalizations, such as reducing adverse drug reactions. So to sum up, a few recommendations. As you can see, the studies have demonstrated that pharmacists can help in reducing the overall spending in healthcare systems. And they can have the early involvement of pharmacists in the time of prescribing can provide an opportunity to intervene and generate cost saving to the whole healthcare system. With this, I would like to end up my presentation. Thank you very much.